Hi, I am Dr. Suhail Bukhari. I am Senior Director, Vascular Surgery and Endovascular Surgery at BLK Max Hospital, New Delhi. We do a lot of all the cases related to vascular surgery problem, any blockage of the arteries anywhere in the body. We treat that, both arteries and veins. So very commonly we see blockage of the superficial femoral arteries. So in this, earlier we used to do bypass surgery. Now we can treat these lesions with or blockages with the endovascular treatment. That is, first we can pass the wire through the tight lesion, then we do the ballooning of the artery, and now after that we use the self-expandable stents, and Promosa is a good quality stent. We have used many Promesas for these lesions and we have seen very good results, and nowadays we can even treat them by using a drug-eluting balloons also. So where we don't want to put a short lesion, where we don't want to put the stent, we can use them with the normal, first plain balloon, then drug coated balloon.